So now we get to enjoy a discussion. So what committee questions have emerged for you during this engaging discussion of barriers, something we all grapple with? I know you're all awake.
If you don't talk, we're just going to start a debate among us.
Yeah, and with that, I want to say I really enjoyed your presentation, both of your presentations, but I think it's really outstanding that some of the same challenges that I was thinking of, all three of us, and we didn't even collaborate, what we were going to say before this were the same and very similar. So.
Okay, my turn again. You identified a number of barriers that are at the store level. And this committee is charged with thinking about the food packages. That is in some ways kind of outside of our brief for this committee, our statement of task. You also mentioned some things that I think are kind of in the range of the store and the family and the utilization, which is sizes and stock sizes. So if the size is available, you want the store to be able to stock it reasonably. But for all the things you said about the shopping experience, can you highlight any that you think this committee, that is in our portfolio to deal with?
For each of us or for me? All of you. Oh, okay. Well, I'll let...
Well, I think some of the things that are interesting when I look at the Time for a Change report, and then I think about how it got translated and then what you would be looking at again. One of the things that was in the Time for a Change report was, as I'm sure you remember, was a recommendation around the fruits and vegetables that there would be a guaranteed amount option. So it basically said you could have fresh and then you could have a processed food option. And it said so you get a guaranteed amount of, it was canned foods. So one thing I think, if you want to talk about maximizing the benefit or guaranteeing the benefit, you could look at that option. I wouldn't keep it canned foods, but you could do canned or frozen and consider how you could guarantee the number of servings, because one of the big issues in terms of actually translating the package into reality, which is, I think, part of your question, is the differential in the cost of living and the price of, for example, produce from place to place. And ERS looked at that and showed, you know, you've got a really dramatic difference in the amount of fruit and vegetable servings you're going to get if you live in San Francisco as opposed to some other lower cost place like Alabama. So I think one thing you could do is take a look at that. Is there an opportunity for offering both a cash value voucher but also a guaranteed amount, which was the footnote A in the last proposal, Time for a Change, the processed food option. So that's one I would certainly take up. I guess the other thing I would say really quickly is that I think it's important, and this was a discussion last time, to have a balance between what are actually federal requirements, the bottom line, which is what was recommended for Time for a Change, and what was actually implemented. I think this is a federal food program, and it should have national federal requirements that everyone has to pass and everyone has to use, like the minimums, which is what USDA put in. And it's within that, I think, we want to look at these issues about the package sizes and how you accommodate, because I completely agree on the bread. And I'm glad, actually, that Stan brought it up, because I was going to bring it up, but then I thought where people were going to say enough already about the bread. It's done, like, leave it alone. But I think it's true that you could ask the National Bakers Association, they have an average size of bread, and if you could put that in there. From a cost perspective, just real quick to finish up on that, I think what you'd have to look at is not just what's the difference in the amount of bread that you would be providing if you did that, but actually what's the price that's being paid for the 1 pound bread, and then account for the fact that you wouldn't be paying that, what I think is a higher price, and put that into the cost accounting. And my final point is that I think when you're looking at the WIC food package, and I don't know the scoring rules, but it might be worth considering what the interface with ACA is and what is probably the increased ability for the state WIC and local WIC to shift the cost of some of the more expensive formula and foods to ACA. So those are my suggestions.
Oh, okay. Couple thoughts to consider. from the client standpoint. I think more options for products that we know clients aren't purchasing. For example, there's a report by Alterum, it's Transition to EBT and WIC, review of the impact and examination of participant redemption patterns. This tells us what clients are buying. At a very granular level, I have it by UPC, and so do the other states in here. But I think, for example, there's some products like milk. If you look at the redemption level for that, if you look at the redemption level of the infant meats, I think we need to give clients more choices and more options. I think that's really key. But the redemption, I think, is the proof. What are our clients purchasing? We can decide what we think is a great food package, and we can prescribe it, but unless they select it, get it home, and then they have to consume it, we're not going to see that real, true nutritional value give us any benefit. The range and sizes of packages, I think we've talked about. And also, if you look at prices of some things, if you look at the price of 48-ounce juice, what I can tell you is, looking at redemption data, the 48-ounce juice versus the 64-ounce juice, it's only about 50 cents difference. If you look at most stores, that 48-ounce container of juice, two things. Number one, they know the WIC clients are buying it, and as I think one of my colleagues mentioned, the stores know that, and they jack up the price. So if you look at the price per ounce, it's higher, and you have less selection. So as a consumer, I normally don't even buy that when I go for the 64-ounce. And the other thing is, when you're thinking of kind of the journey map for the client, how do you like to purchase things? I mean, our WIC clients, they're just like us, they're people, but also, we have to balance the requirement to contain food costs. There's a GAO report, and there's also an OIG report about, reducing our food costs and, looking at various store brands, generic brands, and less choices. Well, as a consumer, our WIC clients that may not be what's in the best interest of our WIC clients. So trying to balance that, I think we're all for saving federal taxpayers' dollars and serving the most clients we can, but look at it from the client standpoint, giving them more choice, different sizes that they can buy, and then, some of the products that don't make sense. So, okay. Sure. Awesome question, Helen, and thanks for that call, or question. I mean, thanks for calling me on that one, because when we went to EBT, rolling it out statewide, we did three things within a one-year period. We put in a new online system called MyWIC. We rolled out EBT statewide, and we put in the new food package. And I will tell you, we had one of the easiest rollouts for the new food package on the system side, because we could flip the switch at the state. Okay? We had to work, ahead of time to make sure that our vendors knew what the new items were, and we did training and education through our Michigan Grocers Association. But as far as challenges, when considering, saying, okay, I think one of the options for states are bananas for baby food. Okay, I'm gonna try to make this not ridiculous, but okay, bananas in WIC are based on a dollar value. Okay, and then you can equate that to so many jars of baby food. Okay. So how do you do that in the EBT world? I'm scratching my head. I talked to the Texas WIC director. We're scratching our head. We're asking, guidance from USDA. It makes it difficult. I think it's a great idea to be able to have an exchange of fresh fruit like a banana for jars of baby food. Because quite honestly, you can look at the redemption data. For our older infants, they're not buying the jars of baby food, nor the infant meat. So kind of look at, if there's an exchange for that we would have to do that at the state level and make a system modification for that. So, okay, so I'm just going to try to give you a quick example. 3 jars of baby food versus bananas. How many bananas do I equate it? How much is a banana? 59 cents a pound. How big is the average banana? I'm not really sure. Do you have organic bananas? Yes. You know, so it's like, you know, it's just hard to quantify. So it's things like that. I think it's a great option, but then, you know, we have to get some type of guidance that we can all you know, do that type of equation. So that's one of the challenges that comes to mind. So,
Arlene.
if I can say, and my colleagues that have moved to EBT, it is much better than paper. It is easier to make the changes. You know, we can download new food items to all the stores. I should say the category, subcategory, and UPCs much easier than you can in the paper world. Clients love the EBT compared to the paper coupons, and I really think it's in the best interest of all the stakeholders that touch WIC.
Thank you. Charlene Russell Tucker, and I think it's Stan. Actually, in the vein of what you were just talking about, could you say more about the self-checkout? Sure. Curious to see if there's any lessons that will be learned there that can be utilized. Did you demystify the whole process in doing that?
Sure. Self-checkouts, this is very interesting. I'll try to make this brief. I don't know how much time we have, but when we went to pilot EBT in Jackson County, we were really looking for one retailer that would integrate. And integrate basically means that all the same equipment that store existingly has, they could use for WIC. And Myers Corporation, that's out of Grand Rapids, Michigan, we went to their headquarters. I pleaded with them, please, would you do this? And one of the vice presidents said, you know, we think WIC is great, and it's good for the customers, and it's good for the community, so we're going to work with you. And I went to USDA, and they gave us some funding, and we integrated. So we piloted that in Jackson County, and then we had some other changes that we had to make, and through the testing process, on-site in the headquarters of Myers, we've got the USDA people there, they're technical consultants. The person that was the lead person we've been working with says, hey, this summer I had a student, and they programmed your system for self-checkout. You want to take a look at it? And right then, I think some of the USDA folks are there. Aaron McBride was right next to me because he was the key person from USDA. Says, yeah, we want to look at it. So we tested everything that we did in the other scenario with the self-checkout, and everything passed. Isn't that amazing? So then we pilot tested that, and we made sure that it worked. But a couple things, all major retailers are now moving in that direction, and you know why? Once one of their competitors get it, they want it too, and they hear about it. So all the major retailers are moving in that direction.
Patsy, you'll be our last question. This little gadget's telling me we have 3 minutes.
Thank you. So Patsy Brown, and so I want to ask Stan, your ability to roll out from the state level UPC codes for products that you're going to allow or not allow. Can you do that on the standalone scanning systems as well as the integrated systems?
Absolutely. Since we are online, all the stores are connected on an ongoing basis to the EBT host. So for example, if we're going to roll out, say, a new series of UPCs, or let's say a new category, or say a new food product, or say we're going to add yogurt, which we will at a certain point in time, we determine when that's going to be authorized. We make sure the vendors know about it, the retailers. We make sure the clients know about it, and it's in our food card. And then when they connect back to the state, we say everything that's going to be new, we send it to them in a file. They have it on their device in the store, even they call it stand beside systems, because there's kind of like a mini server device where all that is stored, and then so those new UPCs are there. So a couple things we do is we can check which stores have it uploaded and are connected. We also send staff out to a couple random stores just to make sure that everything is there and working. Did that answer your question? Okay.
Well, panel, thank you. Tina, your study is lovely and elegant. Thank you for the study on incentives. And Jerry and Stan, thanks for bringing the real world of WIC to our committee. It was very helpful.
Thank you.
Yeah.